The Millennium Development Goals, MDGs, were 8 international development goals for the year 2015 that had been established following the Millennium Summit of the United Nations in 2000, following the adoption of the United Nations Millennium Declaration. These were based on the OECD DAC International Development Goals agreed by development ministers in the Shaping the 21st Century strategy. The Sustainable Development Goals, SDGs, succeeded the MDGs in 2016. All 191 United Nations member states, and at least 22 international organizations, committed to help achieve the following Millennium Development Goals by 2015. 1. To eradicate extreme poverty and hunger. 2. To achieve universal primary education. 3. To promote gender equality and empower women. 4. To reduce child mortality. 5. To improve maternal health. 6. To combat HIV/AIDS, malaria, and other diseases. 7. To ensure environmental sustainability. 8. To develop a global partnership for development. Each goal had specific targets, and dates for achieving those targets. The 8 goals were measured by 21 targets. To accelerate progress, the G8 finance ministers agreed in June 2005 to provide enough funds to the World Bank, the International Monetary Fund, IMF, and the African Development Bank, AFDB, to cancel $40 to $55 billion in debt owed by members of the heavily indebted poor countries, HIPC, to allow them to redirect resources to programs for improving health and education and for alleviating poverty. Interventions evaluated include: 1. Improvements required to meet the Millennium Development Goals, MDG, for water supply, by having by 2015 the proportion of those without access to safe drinking water. 2. Meet the water MDG plus having by 2015 the proportion of those without access to adequate sanitation. 3. Increasing access to improved water and sanitation for everyone. 4. Providing disinfection at point of use over and above increasing access to improved water supply and sanitation. 5. Providing regulated piped water supply in-house and sewage connection with partial sewerage for everyone. Hutton, G. Evaluation of the cost and benefits of water and sanitation improvements at the global level, 2004. WHO Geneva. Critics of the MDGs complained of a lack of analysis and justification behind the chosen objectives, and the difficulty or lack of measurements for some goals and uneven progress, among others. Although developed countries' aid for achieving the MDGs rose during the challenge period, more than half went for debt relief and much of the remainder going towards natural disaster relief and military aid, rather than further development. As of 2013, progress towards the goals was uneven. Some countries achieved many goals, while others were not on track to realize any. A UN conference in September 2010 reviewed progress to date and adopted a global plan to achieve the 8 goals by their target date. New commitments targeted women's and children's health, and new initiatives in the worldwide battle against poverty, hunger, and disease. Among the non-governmental organizations assisting were the United Nations Millennium Campaign, the Millennium Promise Alliance Incorporated, the Global Poverty Project, the MICA Challenge, the Youth in Action EU program, Cartoons in Action Video Project and the 8 Visions of Hope Global Art Project. Following the end of the Cold War, a series of UN-led conferences in the 1990s had focused on issues such as children, nutrition, human rights, and women, producing commitments for combined international action on those matters. The 1995 World Summit on Social Development produced a Copenhagen Declaration on Social Development with a long and complex list of commitments by global leaders, including many adapted from the outcomes of previous conferences. But international aid levels were falling and, in that same year, the Development Assistance Committee of the OECD set up a reflection process to review the future of development aid. The resulting 1996 report, Shaping the 21st Century, turned some of the Copenhagen commitments into 6 monitorable international development goals, which had similar content and form to the eventual MDGs, having poverty by 2015, universal primary education by 2015, eliminating gender disparity in schools by 2005, reductions in infant, child, and maternal mortality by 2015, universal access to reproductive health services by 2015, and adequate national strategies for sustainable development in place everywhere by 2015. In late 1997, the UN General Assembly envisaged a special Millennium Assembly and Forum as a focus for efforts to reform the UN system. A year later, it specifically resolved to hold not only the Millennium Assembly but also a Millennium Summit, and mandated the Secretary-General, Kofi Annan, to come up with proposals for a number of forward-looking and widely relevant topics, thus opening the possibility of going beyond the institutional questions of UN reform. Annan's report, when published in April 2000 under the title We the Peoples, The Role of the United Nations in the 21st Century, framed the questions of UN reform within the larger challenges facing the world, the chief of which was identified as to ensure that globalization becomes a positive force for all the world's people, instead of leaving billions of them behind in squalor. In the report, Annan urged the forthcoming Millennium Summit to adopt certain key goals and objectives on many of the issues raised in the Copenhagen Summit, other conferences of the 1990s, and the recently published Brahimi Report on International Peace and Security. The Millennium Summit and the General Assembly in September 2000 issued a Millennium Declaration echoing the agenda that Annan had set out. This declaration did not specifically mention Millennium Development Goals, but it does contain the substance, and much of the same wording, as the eventual goals. A process of selecting and refining the goals from the content of the declaration continued for some time. A crucial moment here was unification between discussions under the auspices of the United Nations and approaches being followed by the OECD based on shaping the 21st century. This unification was agreed at a meeting convened by the World Bank in March 2001. In September 2001, Annan presented to the General Assembly a roadmap towards the implementation of the United Nations Millennium Declaration, which did contain a section specifically about the Millennium Development Goals, enunciating some of them in their eventual wording, and indicating the remaining issues in formulating a definitive set. David Hume and James Scott note that the process of creating the MDGs was diffuse, having no single architect and no clear start or end. They also comment that the process was driven by rich states rather than the countries that would be more the subject of MDG interventions. The MDGs emphasized three areas: human capital, infrastructure, and human rights, social, economic, and political, with the intent of increasing living standards. Human capital objectives include nutrition, healthcare, including child mortality, HIV/AIDS, tuberculosis, and malaria, and reproductive health, and education. Infrastructure objectives include access to safe drinking water, energy, and modern information/communication technology, increased farm outputs using sustainable practices, transportation, and environment. Human rights objectives include empowering women, reducing violence, increasing political voice, ensuring equal access to public services, and increasing security of property rights. The goals were intended to increase an individual's human capabilities and advance the means to a productive life. The MDGs emphasize that each nation's policies should be tailored to that country's needs, therefore most policy suggestions are general. MDGs emphasize the role of developed countries in aiding developing countries, as outlined in Goal 8, which sets objectives and targets for developed countries to achieve a global partnership for development by supporting fair trade, debt relief, increasing aid, access to affordable essential medicines, and encouraging technology transfer. Thus, developing nations ostensibly became partners with developed nations in the struggle to reduce world poverty. Goal 8: to develop a global partnership for development. The MDGs were developed out of several commitments set forth in the Millennium Declaration, signed in September 2000. There are 8 goals with 21 targets, and a series of measurable health indicators and economic indicators for each target. Goal 1: eradicate extreme poverty and hunger. Goal 2: achieve universal primary education. Goal 3, promote gender equality and empower women. Goal 4, reduce child mortality rates. Goal 5, improve maternal health. Goal 6, combat HIV/AIDS, malaria, and other diseases. Goal 7, ensure environmental sustainability. Goal 8, develop a global partnership for development. General criticisms include a perceived lack of analytical power and justification behind the chosen objectives. Some of the indicator definitions, baselines, and targets were changed after their first adoption, to suggest that progress had been better than was really the case. The MDGs lack strong objectives and indicators for within-country equality, despite significant disparities in many developing nations. Iterations of proven local successes should be scaled up to address the larger need through human energy and existing resources using methodologies such as participatory rural appraisal, asset-based community development, or seed scale. MDG 8 uniquely focuses on donor achievements, rather than development successes. The Commitment to Development Index, published annually by the Center for Global Development in Washington, D.C., is considered the best numerical indicator for MDG 8. It is a more comprehensive measure of donor progress than official development assistance, as it takes into account policies on a number of indicators that affect developing countries such as trade, migration, and investment. The MDGs were attacked for insufficient emphasis on environmental sustainability. Thus, they do not capture all elements needed to achieve the ideals set out in the Millennium Declaration. Agriculture was not specifically mentioned in the MDGs even though most of the world's poor are farmers. The entire MDG process has been accused of lacking legitimacy as a result of failure to include, often, the voices of the very participants that the MDGs seek to assist. The International Planning Committee for Food Sovereignty, in its post-2015 thematic consultation document on MDG 69 states the major limitation of the MDGs by 2015 was the lack of political will to implement due to the lack of ownership of the MDGs by the most affected constituencies. The MDGs may underemphasize local participation and empowerment, other than women's empowerment. FIAN International, a human rights organization focusing on the right to adequate food, contributed to the post-2015 process by pointing out a lack of primacy of human rights, qualifying policy coherence, and of human rights-based monitoring and accountability. Without such accountability, no substantial change in national and international policies can be expected. MDG 2 focuses on primary education and emphasizes enrollment and completion. In some countries, primary enrollment increased at the expense of achievement levels. In some cases, the emphasis on primary education has negatively affected secondary and post-secondary education. A publication from 2005 argued that goals related to maternal mortality, malaria, and tuberculosis are impossible to measure and that current UN estimates lack scientific validity or are missing. Household surveys are the primary measure for the health MDGs but may be poor and duplicative measurements that consume limited resources. Furthermore, countries with the highest levels of these conditions typically have the least reliable data collection. The study also argued that without accurate measures, it is impossible to determine the amount of progress, leaving MDGs as little more than a rhetorical call to arms. MDG proponents such as MacArthur and Sachs countered that setting goals is still valid despite measurement difficulties, as they provide a political and operational framework to efforts. With an increase in the quantity and quality of healthcare systems in developing countries, more data could be collected. They asserted that non-health-related MDGs were often well measured, and that not all MDGs were made moot by lack of data. The attention to well-being other than income helps bring funding to achieving MDGs. Further, MDGs prioritize interventions, establish obtainable objectives with useful measurements of progress despite measurement issues and increase the developed world's involvement in worldwide poverty reduction. MDGs include gender and reproductive rights, environmental sustainability, and spread of technology. Prioritizing interventions helps developing countries with limited resources make decisions about allocating their resources. MDGs also strengthen the commitment of developed countries and encourage aid and information sharing. The global commitment to the goals likely increases the likelihood of their success. They note that MDGs are the most broadly supported poverty reduction targets in world history. Achieving the MDGs does not depend on economic growth alone. In the case of MDG-4, developing countries such as Bangladesh have shown that it is possible to reduce child mortality with only modest growth with inexpensive yet effective interventions, such as measles immunization. Still, government expenditure in many countries is not enough to meet the agreed spending targets. Research on health systems suggests that a one-size-fits-all model will not sufficiently respond to the individual healthcare profiles of developing countries. However, the study found a common set of constraints in scaling up international health, including the lack of absorptive capacity, weak health systems, human resource limitations, and high costs. The study argued that the emphasis on coverage obscures the measures required for expanding healthcare. These measures include political, organizational, and functional dimensions of scaling up, and the need to nurture local organizations. Fundamental issues such as gender, the divide between the humanitarian and development agendas and economic growth will determine whether or not the MDGs are achieved, according to researchers at the Overseas Development Institute, ODI. The International Health Partnership, IHP+, aimed to accelerate MDG progress by applying international principles for effective aid and development in the health sector. In developing countries, significant funding for health came from external sources requiring governments to coordinate with international development partners. As partner numbers increased, variations in funding streams and bureaucratic demands followed. By encouraging support for a single national health strategy, a single monitoring and evaluation framework, and mutual accountability, IHP+ attempted to build confidence between government, civil society, development partners, and other health stakeholders. Further developments in rethinking strategies and approaches to achieving the MDGs include research by the Overseas Development Institute into the role of equity. Researchers at the ODI argued that progress could be accelerated due to recent breakthroughs in the role equity plays in creating a virtuous circle where rising equity ensures the poor participate in their country's development and creates reductions in poverty and financial stability. Yet equity should not be understood purely as economic, but also as political. Examples abound, including Brazil's cash transfers, Uganda's eliminations of user fees and the subsequent huge increase in visits from the very poorest, or else Mauritius's dual-track approach to liberalization, inclusive growth and inclusive development, aiding it on its road into the World Trade Organization. Researchers at the ODI thus propose equity be measured in league tables in order to provide a clearer insight into how MDGs can be achieved more quickly. The ODI is working with partners to put forward league tables at the 2010 MDG review meeting. The effects of increasing drug use were noted by the International Journal of Drug Policy as a deterrent to the goal of the MDGs. Improving living conditions in developing countries may encourage healthy workers not to move to other places that offer a better lifestyle for their countries. Cuba, itself a developing country, played a significant role in providing medical personnel to other developing nations. It has trained more than 14,500 medical students from 30 countries at its Latin American School of Medicine in Havana since 1999. Moreover, some 36,000 Cuban physicians worked in 72 countries, from Europe to Southeast Asia, including 31 African countries, and 29 countries in the Americas. Countries such as Honduras, Guatemala, and Nicaragua benefit from Cuban assistance. Although there have been major advancements and improvements achieving some of the MDGs even before the deadline of 2015, the progress has been uneven between the countries. In 2012, the UN Secretary-General established the UN System Task Team on the post-2015 UN Development Agenda, bringing together more than 60 UN agencies and international organizations to focus and work on sustainable development. At the MDG Summit, UN member states discussed the post-2015 development agenda and initiated a process of consultations. Civil society organizations also engaged in the post-2015 process, along with academia and other research institutions, including think tanks. The Sustainable Development Goals, SDGs, have been proposed as targets relating to future international development once the MDGs expire at the end of 2015. On July 31, 2012, Secretary-General Ban Ki-moon appointed 26 public and private leaders to advise him on the post-MDG agenda. In 2014, the UN's Commission on the Status of Women agreed on a document that called for the acceleration of progress towards achieving the Millennium Development Goals, and confirmed the need for a standalone goal on gender equality and women's empowerment in post-2015 goals, and for gender equality to underpin all of the post-2015 goals. The UN's Commission on the Status of Women electing to have created a goal dedicated to gender equality and the empowerment of women further demonstrated how the United Nations' Millennium Development Goals did not make much progress on gender equality. The goal of achieving gender equity is still a prominent issue and factor in global development due to its ties to the rest of the SDGs. The United Nations Millennium Campaign was launched to increase support for the Millennium Development Goals. The Millennium Campaign targets intergovernmental, government, civil society organizations and media at global and regional levels. The Millennium Promise Alliance Incorporated, or simply the Millennium Promise, is a U.S.-based nonprofit organization founded in 2005 by Jeffrey Sachs and Ray Chambers. Millennium Promise coordinated the Millennium Villages project in partnership with Columbia's Earth Institute and UNDP. It aimed to demonstrate MDG feasibility through an integrated, community-led approach. The project ran from 2005 to 2015, operating in 15 sites across 11 countries in sub-Saharan Africa. The Global Poverty Project, later rebranded as Global Citizen, supported the MDGs. The Micah Challenge was an international campaign that encourages Christians to support the Millennium Development Goals. Their aim was to encourage our leaders to have global poverty by 2015. The Youth in Action EU program Cartoons in Action project created animated videos about MDGs, and videos about MDG targets using arcade C64 video games. The World We Want 2015 was a platform and joint venture between the United Nations and civil society organizations that supported citizen participation in defining a new global development framework to replace the Millennium Development Goals. The Teach MDGs, and Accessing Development Education European projects, coordinated by Future World Center, aim to increase MDG awareness and public support by engaging teacher training institutes, teachers and pupils in developing local teaching resources that promote the MDGs with a focus on sub-Saharan Africa. Global Education Magazine is an initiative launched by the teaching team that formulated the proposal most voted in the group Sustainable Development for the Eradication of Poverty in Rio +20. It is supported by UNESCO and UNRWA and aims to create a common place to disseminate transcultural, transpolitical, transnational, and transhumanist knowledge. Albright and Kuya, 2007, write that cultural and financial barriers in sub-Saharan Africa impede library and information science education programs. As a result, MDG goals for poverty, healthcare, and education fall short. High rates of HIV/AIDS, and escalating child and maternal mortality are the direct result of poverty and substandard medical care. Limited instruction in information access and exchange contributes to this ongoing dilemma. Remember the 8 Millennium Development Goals were: #1. Eradicate extreme poverty and hunger. #2. Achieve universal primary education. #3. Promote gender equality and empower women. #4. Reduce child mortality. #5. Improve maternal health. #6. Combat HIV/AIDS, malaria, and other diseases. #7. Ensure environmental sustainability. #8. Develop a global partnership for development. Thank you for watching this video.